A 42-year-old man walks into an emergency room not because he feels sick, but because he feels unusually good. In just 5 months, he has lost nearly 18 kilograms using a GLP-1 medication he discovered through social media trends and online discussions. His friends call it a breakthrough. His confidence improves, his blood sugar stabilizes, and his reflection in the mirror changes faster than he ever imagined possible. But one night, everything shifts when he wakes up with tight chest pressure, sweating, and an unexplained sense of danger that he cannot describe. He assumes it is anxiety, but clinically, it is something far more complex and uncertain. Across the world in 2026, GLP-1 drugs are being celebrated as one of the most powerful revolutions in obesity treatment, transforming metabolic medicine in ways never seen before. Yet, at the same time, cardiologists and researchers are beginning to ask a more uncomfortable question about whether this rapid transformation is fully understood in terms of long-term cardiovascular safety. Because behind the visible success stories of weight loss, there are subtle and often overlooked physiological changes involving heart rhythm variability, blood pressure adaptation, hydration imbalance, electrolyte shifts, autonomic nervous system modulation, and metabolic stress responses that many users do not notice until the body begins to signal distress. So, the real question is no longer whether GLP-1 drugs work, because they clearly do, but rather what they are doing silently inside the body while external transformation appears so positive. My name is Dr. Emmanuel, and I am a medical doctor with more than 15 years of experience in internal medicine and cardiology, specializing in metabolic heart health, obesity-related cardiovascular complications, and preventive medical care. I completed my medical training at a reputed institution and have spent years working closely with patients dealing with diabetes, obesity, hypertension, and early heart disease, where I have seen both the benefits and the unintended consequences of modern metabolic therapies. Welcome to the clinic, where you find all solutions from true professionals, a trusted source for deep health understanding, evidence-based treatments, and life-changing medical guidance designed to help you understand your body at a clinical level rather than a social media level. This platform is not about hype or fear, but about clarity, science, and real human biology explained in simple terms so that you can make informed decisions about your health. Today we are discussing GLP-1 drugs, which are among the most advanced pharmacological tools in modern obesity and diabetes management, widely studied across global research frameworks, including WHO metabolic guidelines, NIH-supported research programs, and large-scale cardiovascular outcome trials that explore both benefits and risks in different patient populations. To understand these medications properly, you first need to understand what they actually do inside your body. GLP-1 drugs mimic a natural hormone called glucagon-like peptide 1, which plays a central role in regulating appetite, digestion speed, and insulin response. In simple terms, this hormone tells your brain that you are full, signals your pancreas to release insulin more efficiently, and slows down how quickly food leaves your stomach. This is why people using these medications often feel full very quickly, lose interest in overeating, and begin losing weight without extreme dieting. However, what most people do not realize is that this is not just an appetite switch being turned on or off, but a deep neurometabolic signal system being modulated, meaning the communication between your brain, gut, hormones, and cardiovascular system is being actively reshaped. And whenever a central system like this is modified, the body does not respond in a single dimension. It adapts across multiple systems simultaneously, including heart rate regulation, stress response, energy distribution, and even emotional perception of hunger and reward. Many individuals using GLP-1 medications experience common early effects such as reduced appetite, mild nausea, occasional fatigue, or or slight dizziness, and these are often expected and considered part of the adaptation phase. However, what becomes clinically more important are the subtle signals that are frequently ignored, such as an increased resting heart rate, intermittent palpitations even at rest, lightheadedness when standing up, mild chest discomfort that comes and goes, and sleep disturbances that are not always immediately linked to the medication. The challenge here is not that these symptoms are always dangerous, but that they are often misinterpreted as normal weight loss effects, when in reality, they may represent the cardiovascular system adjusting to rapid metabolic change. Because from a physiological perspective, when body weight drops quickly, blood pressure often shifts, fluid balance changes, and the heart begins to compensate for reduced blood volume by subtly increasing its activity, which can create sensations of awareness in the chest or heartbeat that feel unusual to the patient. At the same time, GLP-1 drugs influence multiple interconnected systems, including the brain's appetite control centers, gut motility, insulin sensitivity, and autonomic nervous system balance. This means the body is not only losing weight, but also recalibrating how it regulates energy, stress, and internal stability. In some individuals, this recalibration can shift the balance between the sympathetic and parasympathetic nervous systems, which are responsible for fight or flight responses and rest and digest states, respectively. When this balance shifts, some people may experience increased heart rate sensitivity, mild anxiety-like sensations, or sleep pattern changes, not because the heart is damaged, but because the nervous system is adjusting to a new metabolic baseline. However, this adaptation phase requires careful monitoring, especially in individuals who already have hidden cardiovascular risk factors. Another important and often overlooked mechanism is the effect of rapid weight loss on metabolic adaptation. When the body loses weight quickly, it does not immediately accept this as a positive outcome. Instead, it interprets it as a potential energy deficit state and activates survival-based adjustments. This can include lowering metabolic rate, altering cortisol levels, shifting energy conservation pathways, and changing how the cardiovascular system distributes workload. This is why some individuals report feeling completely fine during the day, but experience fatigue, palpitations, or discomfort at night as the body cycles through different regulatory states during adaptation. In addition to this, reduced appetite often leads to reduced protein intake and lower hydration levels without the person consciously realizing it, which can contribute to mild muscle loss and changes in cardiovascular efficiency over time. Since the heart itself is a muscle-dependent organ that relies on overall muscular and metabolic stability to function optimally. Dehydration is another major but under-discussed factor in GLP-1 therapy because appetite suppression often indirectly reduces fluid intake as well. When hydration decreases, blood volume can drop slightly, leading to compensatory increases in heart rate, mild drops in blood pressure, and occasional dizziness or palpitations. Even mild dehydration can influence cardiovascular rhythm stability, particularly in individuals who are sensitive or have underlying risk factors that have not yet been diagnosed. This is why some patients experience seemingly unexplained symptoms even when their weight loss journey appears successful externally, because internally the cardiovascular system is constantly adjusting to new fluid and metabolic conditions. There is also a psychological dimension to consider because GLP-1 medications affect brain reward pathways that regulate not only hunger but also motivation, pleasure response, and emotional association with food. Some individuals report a reduced emotional connection to eating, which can feel liberating at first, but may also create a sense of unfamiliarity as the brain adjusts to a new reward baseline. This does not indicate harm, but rather neuroadaptation adaptation, where the brain is learning to operate under a different metabolic signaling environment. And since brain chemistry is closely connected to stress hormones and autonomic function, these psychological shifts can indirectly influence cardiovascular perception and overall body awareness. From a clinical perspective, GLP-1 therapy typically follows a pattern where initial rapid improvement is followed by a phase of adaptation and then either stabilization or mild sensitivity, depending on individual physiology, hydration, nutrition, sleep quality, and underlying health conditions. The key factor that determines outcomes is not just the medication itself, but how well the body is supported during the transformation process. This includes adequate hydration, sufficient protein intake, gradual weight loss rather than extreme rapid reduction, and proper monitoring of cardiovascular indicators over time, rather than isolated readings that may not reflect the full picture. Many myths circulate around these medications, such as the belief that they are simply fat loss injections or that reduced appetite automatically means improved health. But clinically, these assumptions are incomplete. GLP-1 drugs are powerful metabolic regulators that affect multiple systems simultaneously, and while they offer significant benefits in appropriate medical contexts, they are not simple cosmetic tools. Weight loss alone is not a complete measure of health, because true health includes cardiovascular stability, muscular integrity, hormonal balance, sleep quality, and long-term metabolic resilience. A person can lose weight while still undergoing internal physiological stress if the process is too rapid or not properly supported. The most important clinical insight is that GLP-1 medications do not simply reduce hunger, they reorganize how the body manages energy. And whenever energy systems are reorganized, every dependent system, including the heart, brain, gut, and hormones, must adapt. This adaptation is not inherently dangerous, but it requires awareness, patience, and medical supervision to ensure stability. Fast results may feel emotionally rewarding, but the body does not adapt at the same speed as external change, and this mismatch is where many symptoms originate. From an emotional and human perspective, it is important to understand that if you are using or considering these medications, you are not just trying to lose weight. You are trying to improve your health, confidence, and quality of life, and that intention is valid and understandable. However, health transformation is not about speed. It is about sustainability. And the smartest outcome is not the fastest weight loss, but the safest and most stable long-term change. Your body is not working against you. It is constantly trying to adapt to every new condition you create, and your responsibility is to support that adaptation rather than force it. In conclusion, GLP-1 drugs represent one of the most significant advancements in modern metabolic medicine, offering real benefits for weight management and diabetes control, but they also require respect for the complexity of human physiology. The heart, brain, and metabolic system are deeply interconnected, and any intervention that affects one will inevitably influence the others. Therefore, the goal is not to fear these medications, but to understand them deeply, use them responsibly, and monitor the body intelligently throughout the process. If you found this insight valuable, continue learning, stay aware of your body's signals, and always prioritize long-term stability over short-term transformation. Because true health is not measured by rapid change, but by how well your body sustains that change over time. If this deep medical breakdown helped you understand GLP-1 drugs in a completely new way, make sure you don't stop here. Subscribe to Emmanuel Clinic for more evidence-based cardiology insights, metabolic health education, and real doctor-led explanations that go beyond surface-level health advice. Like this video if you want more in-depth medical documentaries like this, because it helps the algorithm push this content to people who genuinely need it. Comment below your experience, your concerns, or any symptoms you've noticed while using weight loss medications, because your story might help someone else make a safer decision. And don't forget to share this video with someone who is currently on a weight loss journey, because understanding your body is the first step toward protecting your heart and long-term health. Stay connected with Emmanuel Clinic, where we turn complex medical science into simple, life-saving knowledge that keeps you informed, aware, and ahead of your health.